Important topic. I love talking about women's health. I think it's great seeing my patients, talking to their friends and family more about women's health. And so hopefully tonight we'll give you some information about, what is HPV, what is cervical cancer, risk factors, and maybe explain some of the screening methods that are out there and what might be right for you. So why cervical cancer screening matters? It's because cervical cancer is preventable. That's why we can screen for it. We have a good screening test for cervical cancer. We have a good screening test for breast cancer. So, getting your pap smear, getting your mammograms, these things do catch cancer early, which is good because then we can treat them. Cervical cancer screening also is important because the majority of cervical cancers are caused by HPV. So if we understand HPV and how to prevent HPV, then we can prevent cervical cancer. Screening, and I'm going to talk about what screening is and pap smears, etc. They do work and they do find problems such as abnormal cells or precancerous lesions early so that they can be treated and so that we never get to cancer in the first place. And again, like I said, having your annual visits and getting screened is important because early treatment and early intervention really does work very well and prevents us to getting to a later stage. So, what are some risk factors for cervical cancer? And again, I list the risk factors for HPV because 99% of cervical cancers are caused by HPV, which is a virus. And so some risk factors are immunosuppression. So any disease, chronic disease that dampens your immune system, such as HIV, or if you're on chronic steroids for lupus or other chronic illnesses. Smoking is a big risk factor. Limited access to care. So if you're not getting your routine screening, you're less likely to catch something early and more likely to develop a cancer. And because HPV is a sexually transmitted disease, multiple sexual partners, early onset of sexual activity, and other sexually transmitted diseases also put you at risk for HPV, which again then puts you at risk for cervical cancer. So I made this for another presentation, and I think it's really helpful because just because you have HPV does not mean you are going to get a cervical cancer. And this is really important to understand. The majority of women, I'm going to talk about this in a second, have HPV. It takes 10 years for HPV to turn into a problem and cancer. The important thing is that we're finding it and screening women appropriately so that it never turns into a cancer. Once you have HPV, you always have HPV. It integrates into your DNA and you have it forever. And I call him the man in the basement. Sometimes he comes up and causes problems. Other times he goes down in the basement and stays put. So once you have it, you always have it, but that doesn't mean it's always going to cause problems. So to put that into perspective, there are 94 million women in the United States. So this orange circle is all the women in the United States. 80% of women will at some point in their life have HPV. So all these yellow people now have HPV. Only about 5 to 7% of those women with HPV will have an abnormal pap test. They're the blue. About 300,000 women per year in the United States will have a precancerous lesion. So now the yellow is those with HPV, blue is those with an abnormal pap, red is a precancerous lesion, and this blue dot is those who actually get cancer. So only about 12,000 women in the United States will develop cervical cancer out of that 94 million that we started with. And this is because we have good screening tests. And so I have a lot of women who have HPV on their pap smear, but again, you're just in this yellow. So the purpose of screening and following up with your doctor is so that if you ever end up in this light blue or red, that we can treat you before you get to the blue. I hope that makes sense. So what is screening and how do we prevent you from getting to that little blue dot in the middle? So screening is done with a pap smear. It's a simple test that's done during a pelvic exam. And so a common misconception is that a lot of people will go to the gynecologist and have a speculum placed for a pelvic exam, but that is not necessarily the pap smear itself. So just having a pelvic exam does not mean you had a pap test done. The pap test is the actual scraping. It's a long brush that actually scrapes the cells on the cervix. So the pap test has two components that you will commonly hear of. So you'll usually get two results from your provider. It tells you what the cells look like themselves. So they could be normal, atypical, low grade, or high grade changes. That's what the cells look like. And then it can also test for HPV. So do you have HPV or not? And if so, which strain or number of it, as some strains are more likely to cause cancer than others. And the reason that the pap smear is such a great screening tool is because it's quick, it's cheap, it can be done in the office, and even though it's uncomfortable to have a pelvic exam, it's generally well tolerated. So I was going to go through general guidelines for each age just to kind of give you a general overview. Please know that this is not individualized. Every single person has a different background, medical history, pap history, etc. This is just to kind of go over some general guidelines to help put the information out there into perspective and to maybe answer some questions that come up with you and your friends and family. So we do not recommend pap smears before the age of 21. Again, that does not mean pelvic exams, right? You should still see an adolescent gynecologist or a gynecologist to talk about other things, etc. But the pap test itself, where we're looking at the cells or testing for HPV, we don't do this before the age of 21, even if you're sexually active. The reason for that is because most young women will have HPV. And if we treat, it will lead to unnecessary treatment, making the cervix shorter, putting them at risk of preterm delivery, et cetera, in the future. And the majority of HPV at this age, this early, goes away on its own, goes down to the basement on its own. So we don't screen early because we don't want to do any harm early. So in the 20s, along the same concept, so from age 21 to 29, we start looking at the cytology only, the cells. This again is because everyone has HPV, 80% of women, and we don't want to see HPV and do unnecessary treatment because the majority of time it's going to kind of go away and become dormant on its own. So we just do the cytology to look for high grade cells and to really make sure that we're only treating the high grade abnormalities and that we're not treating HPV. If that makes sense. Because remember, the HPV was that whole yellow circle. It doesn't necessarily cause problems. So by doing this, we're only finding that like smaller blue circle by only testing in this age group the cytology. Again, general overview terms. In the bigger age range, the 30 to 65, or the majority of women land, this is where the HPV testing really does come into play. And so the HPV test by itself is kind of the gold standard and what is what is the best. And that can be done once every 5 years if your HPV is negative. The reason for that is because HPV causes 99% of cervical cancer. So if you don't have HPV, the likelihood of you developing a precancerous or cancerous lesion in 5 years is virtually non-existent. So if you don't have HPV, the guidelines really have spread out to that 5 years so that we're not over treating and doing more biopsies and having people come back and get treated because the risk of something bad happening within 5 years with a negative HPV is very low. This is redundant, but you could have the PAP, the cytology, and the HPV done together. That's called co-testing. That's what I typically do in the office. That allows you to look at the cells themselves and the HPV and put that together to make a decision about whether or not to do biopsies or what's called a colposcopy next. Again, if your pap smear, if the cytology is normal and the HPV test is normal, again, not individualized to what your past history is, it can be spaced out to as much as every 5 years. If you don't have access to HPV testing, which some lower socioeconomic communities or rural areas don't have, then a pap test looking at the cytology alone, if normal, could be extended to every 3 years. But again, you talk to your provider about what's right for you. You will talk to women who are having pap smears done every year. That might be because they've had an abnormality in the past. That might be because their doctor isn't up to date with these guidelines. So it's always important if you're getting a pap smear every year, ask your provider why. Were they worried about something on the pap smear? Do I have a history of X, Y, or Z? Because there might be a reason or there might not. So it's important to advocate for yourself and always ask why you're getting it. Screening after the age of 65, some people can stop screening if you have had all normal pap smears and negative HPV for the majority of your life. But some may need to continue screening if you do have a history of a lot of risk factors like chronic immunosuppression, et cetera, a history of cervical cancer, if you have a history of precancerous lesions. I personally think that some of this is outdated and women are living a lot longer. Women are getting divorced. People are remarrying. People are having new sexual partners after the age of 65. So I have a discussion with all of my patients um, about screening after 65. I don't think it's unreasonable if you do. But just so that you know, the guidelines do say that you can stop after the age of 65. This does not mean stop going to the gynecologist. This because again, you still need your pelvic exams, etc. This just means the pap test. However, this is my opinion, not guidelines. I do think it's reasonable if you wanted to advocate for yourself to have screening done after the age of 65, especially if you've had newer partners, if you have any new pain, if you have any new bleeding, etc., then that would definitely prompt a testing to be done after this age. Screening after a hysterectomy, the most important question to ask your provider was what kind of hysterectomy did I have? Meaning, is my cervix still there? The cervix is the bottom part of the uterus. And so, if a supracervical hysterectomy was done, then women will still have their cervix, which means they still need pap smears and still follow those guidelines that I had mentioned before. If you had a total hysterectomy and the cervix was removed, and you have a history of normal pap smears, most of the time you don't need screening anymore. You don't need routine pap smears at the top of the vagina when your cervix is gone, unless you have a reason, meaning you had abnormal pap smears in the past, or you have had abnormal vaginal lesions in the past, or you have other risk factors. So again, these are general guidelines. The point of this slide is really to just bring awareness to, get the operative report, have your provider draw a picture. What did you take out of me? What do I still have left? Because that really can make a difference as to whether or not you still need pap smears going forward. And this I've kind of mentioned before, but who may need more screening than the general guidelines I've mentioned before. So those with a weakened immune system, and that's because a weakened immune system can't fight the HPV and make him go away down into the basement. That means he's going to kind of come up and cause more problems if your immune system can't fight it. If you've had past abnormal pap smears or past precancerous lesions, if you've had a history of cervical cancer yourself, again, most are treatable. And so, after we cure you of your cervical cancer, some do need more screening with more pap smears. But the important thing is to ask your provider what is best for you. Because just because the person next to you is getting pap smears every year doesn't mean that you necessarily need a pap smear every year. And individualized medicine is really, really great because it can optimize the treatment and interventions that you need, and also make sure that we're not over treating everybody in general. I'm going to talk about how to prevent HPV. So we kind of talked about the pap smear as a screening tool for cervical cancer. And the biggest way to prevent cervical cancer is to prevent HPV. And so that's the HPV vaccine. And this helps prevent cervical cancer. Again, vaccinated people still need screening. So just because you got the HPV vaccine doesn't mean you don't need to get your pap smears anymore. You still fall into those guidelines. You're just much less likely to get HPV. And so you less likely to develop a precancerous lesion. However, once you get HPV, the vaccine doesn't make it go away. The vaccine prevents you from getting it in the first place, which is why I put this slide up here. So this is the recommended vaccination schedule and the guidelines. And the absolute best time to get it is the younger ones, the age 9 to 12. And this is for two reasons. It's one, because these preteens have a really high immune response. And so they're likely to really, really make a lot of antibodies that one day in the future, when they're sexually active, they're armed and ready to fight it off. So that's number one. Number two, this age group, they're less likely to be sexually active. So they're less likely to ever have to ever have been exposed to HPV. So this age group, they probably don't have HPV. So by giving them the vaccine, you can really prevent it. If you didn't get it when you were younger, or if you're a parent with kids in this age range, please vaccinate your children or talk to your pediatrician about it if it's right for them. Um, then the catch-up vaccination schedule is 15 to 26. This is what we might be most familiar with. This is 3 doses. If you get it younger, it's just 2 doses. But now that the guidelines have expanded to approve the vaccine up to age 45. The thing with these, though, getting it the later that you get it, the more likely you've been exposed to HPV. I tell all my patients, even if you have HPV, it's still worthwhile to get the vaccine because there's lots of different types of HPV. So, for example, if you have number 45, HPV strain 45, you could still get the HPV vaccine, and that will prevent you, hopefully, from getting maybe number 16 or 18, the bad guys. So, I think a common misconception is, well, I already have HPV, why should I get the vaccine? I still think if you're in these age range that it can be helpful in preventing other strains. It won't, however, make the strain you currently have go away, but it does help your immune system fight things. This was just, again, these are guidelines, so I don't know everybody's individual history who's listening to this talk, so please talk to your provider about the age range and everything that's right for you, because even though I say that age 9 to 12 is best for everybody, we do need to, there are some exceptions for immunocompromised patients who fall more into this age range. Some common myths that I, hear that I feel fine, so I don't need screening. Most people feel totally fine. You might not have abnormal bleeding or pain, but the majority of, precancerous lesions or abnormal pap smears are without um, symptoms. It's really when they grow into a bigger problem or a lesion or something where you're then causing abnormal bleeding or a symptom. I just talked about the I'm vaccinated, so I'm protected. Yes, but you still need to practice safe sex methods. And also, I talked about how it won't get rid of the HPV that you already have. And even though you're vaccinated, you still need screening, meaning pap smears. I'm too old to need screening. We talked about this. So even if you're older, over 65, please talk to your provider about whether you have any chronic illnesses that may damper your immune system, where they may recommend more frequent screening or looking at your pap history, or if you have any bleeding or new symptoms that may warrant a pap test as well. And I talked about this. I had a hysterectomy, so don't need to see my gynecologist anymore. You really, really still do need annual care. There's the vagina, there's the vulva. You might need paps at the top of the vagina. We don't know if you still have a cervix in place, and we don't know if you still have your ovaries. You need mammograms, etc. So please, advocate for yourself, find out what was done at the time of surgery, and continue to see your gynecologist at least every year. So how can you advocate for yourself and protect yourself? So kind of putting this together. So getting the HPV vaccine is the best way to prevent getting HPV, which then would prevent you from getting cervical cancer. The recommended age that it's approved for is 9 to 45, with the lower end being the most effective. I will also say it's incredibly safe. It is one of the safest and best studied vaccines that we have out there. So please talk to your pediatrician or provider about this. You can protect yourself by staying up to date on your routine pap smears. I have a lot of people who say, oh, they push it back a month or 2 months or 4 months, 6 months. Next thing you know, it's been 2 years since you had a pap smear. So screening works when we do it regularly. So really staying on top of it is the best way that screening works. Practicing safe sex, especially with new partners, to reduce your risk of HPV transmission. And this is a really important one, but don't delay on following up with an abnormal pap smear, or if you feel that your appointment is